coming with pain, sickness, they should be comfortable. So if there are some legal hurdles, there should be some alternate arrangement should be made. And this hospital even now, they are getting 200 emergencies per day and they are performing 150 surgeries per day and more than 2,000 outpatients per day. And some of the staff nurses told night 40 patients are looked after by 2 staff nurses. So they need more staff support. Doctors, in spite of all these limitations, they are doing exemplary work. Liver transplants are done. More than 20 liver transplants done. Regular renal transplants are done. But because of the problem in the facilities and because of the no quality space, the number of patients which they have to attend, almost they are attending the same number, but you would have seen the space, there is no any space for the attenders to sit. This all, some comfort should be given to the patients and the attenders. And even post-operative ward, because of doctors' expert management, it is moving smooth. But in spite of everything, some alternate arrangement should be done. A new building should be there, because this is the building which had the facilities some decades. And why some are concerned about the heritage building? Because the way it has been constructed, how a hospital should be, the space, the veranda, the ambience, these all things there are there. So some compromise should be there, and there should not be any compromise on the patient care. That is my concern. And whenever I see a Twitter or a news about the patient care, I am not telling about the doctor's care or nurse's care, about their quality space, it is really disheartening. So my appeal is, they should have a quality space, a comfortable space. You see, when I went to the general ward, only few fans are there. That was a false ceiling, and patients were telling it's garmi, it's so hot. Even we were all sweating. So please, it's very disheartening to see. But I don't want to play a blame game. I want who are all responsible for this to act immediately so that the patients should be with good comfort. Here now 3,000 beds are there. We need more than 3,000 to 4,000 beds here, because we have shifted from some other buildings. But a single building holding the 2 or 3 building space, how you know you can find the difficulty of the doctors. Even for doctors, there is no any space to move about. So they are working in a high risk situation. They are treating the risky patients. So it's high time we have to think about things, because it's quite a long time. Because when they met 2019, and my first appeal was also, and I am always concerned about government institutions, whether it is education institutions or, and being a doctor, you know, our heart will be beating for the poor patients who are admitted. Now heart is beating or bleeding, I don't know. It's really disheartening to see.
Ma'am, you have seen the infrastructure over here, you have seen what kind of necessary requirements they need. You also, I'm sure, must have heard about the BRS leader there, Harish Rao, commenting on how we have not, congratulated the state government in other medical achievements that they have done. He said you are acting like BJP spokesperson than a governor.
I didn't want to comment on it, but only one thing I want to tell. I told that the facility should be restored soon. That was my words. If that word itself says me I am a activist or a spokesperson, I don't know how to convey. As a first citizen of, I always say I am not only the first citizen and one among the common citizen of Telangana. I am much concerned. And when such things are conveyed, it should be taken in the right spirit. And according to me, if a poor patient is dying or suffering without any specialty, without any special care. Not care means not doctor's care. With quality space. And when so much of facilities are there and so much infrastructure in health care, if a patient is dying for want of facilities in a corner of the state, we cannot be so proud about our facilities. There should not be inequality. There should be equal concern about all. So when one part of the people are suffering like this and one portion of the people boast themselves as the developed state, it is my concern. Even if single patient is affected, it is my concern. So I cannot say though I have to appreciate everything. When there is a problem only we can focus. It is not, it is the, whoever may be, whether it is the administration, whether it is the government, it is not needed. Patting is not needed. Thus we can all clap. That's different people around them to clap and laud them. But as a doctor and as a person concerned with the patients, I can say that. But don't I have the right to say? Don't I have the right to convey my concern? And don't I have as a first citizen and among the common citizen to convey my appeal and to my concern about the patients? Because even now I saw 3 children are sitting in the same cot. They should need some space. Hospital means they should make infection, hospital, nosocomial infection may happen. It's all concern. It's not that poor means the condition should be that. Poor people should have such treatment only. I cannot accept that. It should be like a corporate hospital. So that is my concern, because when one portion of the people, one section of the people are suffering and one section of the people are getting good treatment, we cannot say, so there should be a level playing field in whatever may be the department. So I think they have to take in a good spirit, right spirit, and they should come out with some corrective measures, not commenting on that. I'm not worried about all those comments. I want something good thing to happen, that's all. Because I straight away came from the airport and I came here because I want some solution for this, that's all. There is no any contradictory controversy. I want some constructive measures. That is my appeal.
Ma'am, do you think it is right for the ruling government BRS to engage in this kind of politics when it comes to healthcare?
No, again I want to comment on. But from the beginning they are telling so many medical colleges, so many corporate hospitals, so many facilities. But as I said, when a poor patient is suffering without facility, then I cannot say no, because let him suffer. We are going high in our other facilities. That cannot be accepted. That cannot be accepted, because all are human beings, no? Anything? No, that's what. I am thankful to the legal section, by particularly the court, for stepping in. So I think that let that meeting come with fruitful results, with constructive results, so that some solution occur because of the meeting. And again I am telling, my visit to this hospital is to not only to see the facilities, because I have been following the facilities and I have been regularly attending the meetings with different departments, and I have come to this hospital different times. But when the people are in need of it, it is my duty to support them. There is no any politics in this, there is no any controversy in this. As a simple person who take care of the patients, who want all the patients should be happy, and to want all the patients with quality service, this is my appeal. That's all I can say. No, that they have to act differently, because this I think this reconstruction and renovation is not it is not adequate, because they are telling just we have put the false ceiling, and some areas even there is no any false ceiling, and it's not adequate. So patients need much more care and quality space. So they have to make some alternate arrangement, and at the same time, whether it's heritage structure should be safeguarded, everything they should take care. But government cannot just wash away their hands. Okay, legal aspects are there, it is in the court, so let the patient suffer. we are not bothered. That cannot, because even there are some problems. It is the duty of the administration to take care, to alternate methods, to provide alternate space, or to provide quality space in some other area, because they are dealing with more than 2,000 outpatients in this space constraint. I cannot imagine how they are doing. They are doing renal transplants and liver transplants. There should not be any infection. You would have seen the campus, the periphery, how it could be maintained. Because of the old structure, ancient structure, they are unable to maintain also. So, high time there should be some. Yeah, definitely a new building is needed. I cannot compromise on that. Because there is vacant land is there. Another thing I am telling, instead of fighting, it is for heritage, it is for health. Health, heritage or health. Everyone need health also. So there are space, no? 7.5 acres, vacant space is there. Who prevented you from constructing a good hospital there? It could be multi-story. Nowadays, even in a small space, how high nobody is bothered, no? The foundation should be strong. So, that 7.5 acres is more than enough to construct a hospital. You are telling you are developing in different sectors, in all the health sectors, but in a patient is suffering and unable to provide a bed, and 3 children are sitting in the same bed. How can I say it is health sector is developed? They may get some awards, no problem. They may get anything. But when a single person is suffering, and another thing, students have to come here and learn about things, and modern medicine is something different. No, I don't want to comment on anything, because by seeing itself, everyone it's visibly seen. So, because as it is said from 2019, even since I came, I sent some information about that, and when I attended an alumni association here itself, I personally discussed about this, and you would have seen my repeated interviews. I always focus on the patient care, hospital particularly. It's the last hope for the poorest and poor. Politicians can go to a corporate hospital. Middle class people also can go to some private hospital. What will happen to the poorest and poor, which is the last. I'm happy in spite of all these, because of the doctors. Patients are telling we are happy. So when they say, when this minimal support is giving them happiness, it is not that because they are suffering. It is relieved by the doctors. But please give them some space. There is no any. I cannot say how to tell them.
We have discussed about Osmania Hospital and the development, etc. with other politicians as well. You said you've spoken with Chief Minister KCR also regarding this. What has been the response that has come in from?
No, I cannot say now. No, there is no. I cannot respond for this response. Yeah, I will write. Today I will convey, and I will follow the message from the joint meeting. I am following. So what will be the solution? To my part, my efforts will be always there to make the people happy. That's all I can say. Thank you. I will go to wash my hands.